What's going on, guys? Josh Baldwin here from Mad Money Millennial. Slippity slip slap that like and subscribe button around, and let's get into another Social Security update where I will delve right into part 2 of my Q&A video on SNAP benefits for the elderly and disabled. If you missed part 1, you can check the link shown above so that you can get the full picture on these changes. In part 1, we went over things such as eligibility for elderly or disabled folks, how to apply for SNAP benefits, who is considered to be part of a SNAP eligible household, and methods of receiving SNAP benefits. And in this video, we will cover topics including SNAP resources and income limits, and deductions for Medicare and housing. Alright, first things first, what resources can I have and still receive SNAP benefits? So households may have $2,250 in countable resources, such as cash or money in a bank account, or $3,500 in countable resources if at least one member of the household is age 60 or older or is disabled. However, certain resources are not counted when determining eligibility for SNAP. For example, a home and lot, resources of people who receive supplemental security income, resources of people who receive temporary assistance for needy families, also known as welfare, as well as most retirement and pension plans. So if you're receiving any of these benefits as well, not to worry because they will not be counted as resources for the sake of SNAP benefits. Now, as for vehicles, they do count as a resource for SNAP purposes, and it's up to your individual state to determine how vehicles may count toward household resources. Next question, what are the SNAP income limits? Most SNAP households must meet both the gross and net income limits. Otherwise, they are not eligible for SNAP and cannot receive benefits. However, a household with an elderly or disabled person is only required to meet what's called the net income test. Net income means gross income minus allowable deductions. Gross income means a household's total non-excluded income before any deductions have been made. Under federal law, all income is counted towards eligibility for SNAP unless it is explicitly excluded. For SNAP purposes, income includes both earned income, such as wages, and unearned income, such as supplemental security income, as well as veterans' disability and death benefits. Because veterans and disability benefits are not explicitly excluded from income, they are counted when determining a household's eligibility for SNAP. If all members of your household are receiving temporary assistance for needy families, SSI, or in some cases other general assistance, your household may be deemed categorically eligible for SNAP because you have already been determined eligible for other programs. The following table will give an illustration of what the net and gross income limits are for each household size. And last but not least, what deductions are allowed in SNAP? So in general, the deductions allowed include the following: a 20% deduction from earned income, a standard deduction of $167 for household sizes of 1 to 3 people, and $181 for a household size of 4, even more for larger households, a dependent care deduction when needed for work, training, or education, medical expenses for elderly or disabled members that are more than $35 for the month if they are not paid by insurance or someone else, in some states legally owed child support payments, and lastly, in some states a standard shelter deduction for homeless households of $156.74. As for the excess Medicare cost deduction for elderly members and disabled members, allowable medical costs that are more than $35 a month may be deducted unless an insurance company or someone who is not a household member pays for them. Only the amount over $35 each month may be deducted. Allowable costs include most medical and dental expenses such as doctor's bills, prescription drugs, and other over-the-counter medications when approved by a doctor, dentures, inpatient and outpatient hospital expenses, and nursing care. They also include other medically related expenses such as certain transportation costs, attendant care, and health insurance premiums. However, the cost of special diets are not allowed as part of the medical costs. And lastly, on the topic of the excess shelter cost deduction. The shelter deduction is for shelter costs that are more than half of the household's income after other deductions. Allowable shelter costs include fuel to heat and cook with, electricity, water, the basic fee for one telephone, rent or mortgage payments and interest, and taxes on the home. Some states even allow a set amount for utility costs instead of actual costs. The amount of the shelter deduction is capped at or limited to $586 unless one person in the household is elderly or disabled. The limit is higher in Alaska, Hawaii, and Guam. And for a household with an elderly or disabled member, all shelter costs over half of the household's income may be deducted. Alright guys, that's all I have for you on part 2 of this SNAP benefit video series. In our next update, we'll be going over exactly how to calculate your SNAP net income for elderly or disabled households. So stay tuned for that. Stay safe, stay hustling, and I will talk to you guys again soon.